I had never heard of it until I moved here.
Floyd Songer is talking about pickleball. He started playing the sport back in March and hits around with the Cottonwood Pickleball Club at Sun Lakes.
It looks like it's a tennis court, but it's a fourth of the size. And you play it with a wiffle ball with holes in it, and you use a paddle that is about the size of a racquetball racket. So it's a combination of several different sports.
Every year this sport grows. If I could show you a map of the United States 10 years ago, the most popular place to play would have been Washington State. And now we are in every state across the United States.
Sharon Navratil has been hitting the pickleball court since 2010.
You can play as hard as you want to play.
Denise Mitchell picked up her pickleball paddle in 2009. She and Sharon play with the club in Sun City Grand, a sport that, according to the USA Pickleball Association, has more than 200,000 players, ranging from young to old.
We have people in this club that are in their mid to upper 80s, and they come out and they play pickleball. We have people that have had strokes and are paralyzed or partially paralyzed, and they're still out here.
Floyd, Sharon, and Denise also don't let their injuries keep them off the court for too long. They all turn to OrthoArizona for help. Floyd suffered an ankle fracture, had a total knee replacement, and most recently, carpal tunnel surgery.
He was a type of person that he wanted you to be able to go do things. He's not a doctor that wants to limit you.
Floyd was in the care of Dr. Sheldon Martin for all 3 of his surgeries.
I think he's really a role model and not to use the word poster child, but as a good example of what you can achieve if you're motivated and really focused on getting a good outcome and getting back to your activities. I think a lot has to do with it. Sure, if you're undergoing a surgery, you need a good surgeon who's doing using good state-of-the-art latest techniques and so forth, and also having the right physical therapy after surgery.
Sharon had a total knee and partial knee replacement, while Denise had 2 partial knee replacements. They worked with Dr. Stephen Kassman.
I think patients with the partial knee replacement can return to higher levels of function, like my patient who plays hockey or my several who are fairly aggressive skiers. And certainly patients with total knee replacements have many who are avid hikers and hunters. They can play doubles tennis effectively, maybe not the way they played when they were 25 or 30, but they can play effectively. So I think many common recreational things are possible even with a total knee in many patients.
I felt that what he was telling me was the right thing. I'm a retired nurse, so when we talked, he took the time to explain everything to me.
He made me feel positive about it, and so I really didn't have any kind of anxiety going into the surgery.
Injuries that, if taken care of properly, can get people back to their active lifestyles.
These patients they're relatively young, they're in good health, they want to be vigorous, there's things that they want to do, and in the case of both these patients, pickleball was their desired recreational activity and they couldn't participate. So to see them go back and have that enjoyment, it's very rewarding.
If I didn't do it, I wouldn't have these 15 or 20 years to enjoy life.
He said it could take up to 2 years with the total knee replacement. He says, but just take it slow, and he was right.
You just need to get out every day because tomorrow is not promised. And so if you sit around on the couch thinking, well, I'm going to start this tomorrow, then the next day, I'm going to start this tomorrow, you never do it. And life's too short.